Okay, so welcome to Dental CE Academy. Our course this evening, Tooth Adornment Through the Ages, History and Current Perspectives. My name is Dr. Kirsten Kroling. I am the speaker this evening. I'm also the Chief Education Officer here at Dental CE Academy. So welcome. Thank you for joining us. I'd like to turn your attention to a little bit of housekeeping for those of you here live this evening, and that is January the 18th. If you tap on that red banner at the top of the screen, you can download the handout and CE credit instructions. You'll also see an orange box in the chat area. The link to the handout is there as well if that banner does not work on your device. If you are watching this recording later, please scroll below the video player that you see now and go to the instructions section. Number 2 is the handout and number 3 is the quiz. How to receive CE credit for those of you watching live this evening. I'll be redirecting the entire class, all attendees, to a screen to complete the quiz. So please be sure you are here and you are listening, and you'll have your CE credit within a minute after we close. If you're not here and listening, you may struggle a little bit. It may take you a little bit longer, so hopefully you're here. Be sure to ask me questions, and let's go ahead and get started. This is my conflict of interest and financial disclosure. This course this evening has not been supported by any entity, and I am an employee here of Dental CE Academy. The agenda here again for you, 5 to 6, is our CE webinar for 1 live CE credit for those of you watching the live program. Following that, again, we will be taking a brief quiz for CE credit. You'll have 7 days to complete the quiz. You'll need 80% passing score, and we'll also email that quiz to you about 6:05 p.m. shortly after we close. It may take a minute or two to land in your inbox. All right. Our learning objectives are here for you. And why did I create this course? I actually created this course a couple of years ago for a few reasons. I'm a public health dentist here in Arizona. I've worked with numerous NGOs and so forth, the IRC, etc. And I was also working with nonprofits that helped assimilate immigrants to this country. And many of them were coming to me telling me about stories of their various cultural beliefs and practices in their home country. And I thought it was really important to highlight these, at least a few of these, so that we have familiarity because we are working across different cultures. And when I researched this, I realized many of these practices go way back thousands of years. And then I take this all the way to present day, to our grills and bling, etc. And again, this is not new in society. This is a multi-thousand-year cultural practice in many, many countries. If you have any questions, please be sure to write them into the chat area. The chat is moderated. And again, welcome. So I'm going to start this with a video here, and the video is a few minutes long. It's a practice in Bali, and you may be familiar with it. It's called Mediated, and this is a rite to passage. It is highlighting the practice of tooth filing, right? So it looks a bit on the gruesome side, but it is an interesting practice, and you'll see that many of these cultural beliefs are ushering in puberty and that sort of thing. And again, rite to passage, ready for marriage, ready to be put out into society, and parents are saying, fly away, be free, but we want to send you out there with love and respect and make sure that you remember everything you were taught as a child. So here's this practice. We won't watch the entire video, but we're going to highlight some things.
I feel like I aged like 30 years. So now I'm an adult who may or may not be able to eat meat and bite properly. Here in Ubud, teenagers traditionally grind down their canine teeth in a ritual called masange. It's supposed to spiritually break us from our animalistic instincts and ancestors. When we complete this ritual, we're officially an adult and allowed to have sex and marry. Today is the last day of my grandmother's funeral, which means it's my turn to cut spiritual ties with her and become a woman.
Are you nervous?
Yeah, I'm nervous. Soalnya aku Virgo yang nggak suka attention. I feel like such a queen. I have like 2-3 people helping me out. We're in hideaway until we get called up to go do our potong gigi, our tooth filing, and then by then we'll be an adult, according to Balinese spirituality.
Jadi benar-benar gigi kita benar-benar bukan cuma sekedar emang untuk menghilangkan kayak apa ya, taring itu bentuk dari penghilangan satripu, kayak keenam sifat jahat dalam diri manusia.
It's about control yourself. Ya kan, Ge? Control your anger, your jealousy. Ini adalah kewajiban sebagai orang tua, jadi kewajiban yang harus dipenuhi. Tante sebelum kawin ke sini harus Tante potong gigi, karena itu kewajiban orang tua Tante.
15 menit ngapain? Hah? So now they're just saying, like, I think they're going to do the tooth filing at 11, and now they're saying we have to get ready in 15 minutes, and I think there's so many events that are happening, and there's a lot of miscommunication and communication between the priest and the people and us. There's a lot of drama already, like such family and like spiritual and kayak hantu banget sekarang kan. In the meantime, traditional priests, we call them sanggeng, are busy prepping the tools. Each one has its own specific purpose.
Ini pertama namanya ini palu, kita untuk pertama ngambil giginya pertama. Dari itu yang kedua nanti kita gunakan untuk gininya, kikirnya untuk menghaluskan giginya yang dipotong tadi gitu. Dari itu habis itu ini kita pakai kayu cenana namanya untuk supaya kita menjadikan laras giginya tuh bagaimana gitu, supaya kelihatan lebih indah lah gitu, lebih bagus gitu.
It's like the main topic of conversation for everybody. I think women after 20, they're all starting to suspect who their partners are. Biasa. Biasa banget.
Wedding ya?
Go ahead. With you?
No, thank you.
Kita pakai kaos kaki karena kita nggak boleh menjejak tanah, menjejak dunia, dan juga untuk supaya nggak ada evil forces yang datang dan bla bla bla. Tapi dulu kalau misalnya di yang lebih tradisional lagi, biasanya ibu bapaknya yang kayak ngangkat dari balai satu ke balai lainnya. Ini 2018, jadi kita millennial potong gigi 2018. It's fashionable. I hope kayak maunya gambarin Nike symbol gitu, nggak bisa ya. No brands. Aesthetic. Chung chung chung. Now I'm on my way to the ceremony. I know I've said this before, but I really feel like a queen, a spoiled, overly dressed one who's too good to step on the dirty ground. My dad told me not to close my eyes. He joked that in the past people were poisoned when they opened their mouths. So you have to watch out for the haters while you're shining. I was warned not to smile, except in the mirror, to avoid being cursed.
Udah bagus, cantik giginya kak, cantik.
Niki mau kumur.
Ini kumur dulu dikit.
Kumur,
Kumur buang sana ya.
Tiga ya. Tiga, kumur iki bakal. Ini aja.
Cuk nih anggon mas. Udah. Taruh. Ini pakai
Yeah, the minute you lay down, like you really feel benar-benar like now I know why it's like such a serious ceremony, because emang benar-benar kamu tuh ngadapin the roof of the body, so it's like benar-benar intense dan benar-benar like wow.
You feel like an adult now?
I'm not sure. Get back to you. Who knows? Now that they're done with the queen's teeth, my sisters are next. Nggak miring.
Tegus sekarang sama papa.
We might have faked our smiles for this picture, but if you see my parents, their joy couldn't be more real. Maybe it's because masangeh is believed to be a generational ritual, and the final duty parents will carry out for their children. Also, masangeh probably has more to do with family pride than self-discovery, judging by how many group photos I was forced to take. Oh my gosh, photo sesh. Kalau nggak di foto nggak terjadi, emang nggak beneran.
Biasa ada merengek.
Kamu nggak ikut foto?
Nggak. Dibayar, perlu dibayar.
Ini Valer. Nyaman nih Nigel, nyaman nih dan
Okay, so that's a good introduction. We have some more information here for you tonight, but I wanted you to see that because I love that ceremony, although tooth filing is not something I'd practice. I just love the fact that they send their children off into the world, and it's so elaborate, right? And they're telling their children to be good citizens and be kind, and kindness is going to come back to you. And so I love that ritual and tradition. All right, so since ancient times, teeth, the mouth, the face have been the focus of mankind, expressed through many oral and written beliefs, and we're going to see that this evening. Superstitions, traditions, a various wide range of decorative and mutilatory practices. And these various adornments were used to substantiate power, marital status, puberty, warriors, beauty, and more. The practice of tooth alteration and mutilation goes back thousands of years, and it is deliberately modifying the shape of the tooth or teeth. Dentition, we just saw a form here, tooth filing. Tooth mutilation reported in various regions of the world, Pacific, Asiatic, African, South, and Central America areas. And again, it is intentionally altering the tooth. It could be tooth extraction. It could be modifying the shape of the tooth or the surface of the tooth, drilling, filling, notching, grooving, grinding, staining, and chipping are all forms of tooth alteration, and they go all the way back to prehistoric times. So tooth sharpening, it still goes on today, a dental ritual. It's part of the mutilation, and these are practiced among many ethnic groups and cultures. And so you can see here where they've performed tooth filing and sharpened the teeth to points. And we just saw the Mediated ceremony there. And if you weren't able to hear it well, there's the link for you on YouTube. Now, tooth ablation or tooth avulsion is deliberately removing healthy teeth. And I want to point out that this practice and tooth mutilation is not done under local anesthetic, all right? And deliberately why? Because it is considered a rite of passage. So for many, there's a tribal elder perhaps that practices this practice on adolescent children, for instance, as we'll see. And it's been recorded in ancient and modern societies. And the reasons for it are group identification. So you identify with a particular tribe or village, ornamentation, rites of passage, coming of age, marriage, and mourning. And there are risks involved, of course, with tooth ablation. First of all, it's not done under the most sanitary conditions or sterile conditions. It's traumatic, and you'll see very rudimentary instruments that they're using. It can affect eruption patterns, occlusion. It can wear the remaining dentition or affect the remaining dentition. Again, it's performed without anesthesia usually, and there's pain associated with it. So it's often used to demonstrate one's tolerance to pain, like a badge of honor. Of course, infection is concerned. It can impact speech and pronunciation and enunciation, and then there's trauma involved. So practice in old Hawaii was tooth avulsion, and the incisors were knocked out, literally knocked out, as we'll see, with a stick and rock as an act of mourning the death of a loved one. And oftentimes, because of this practice, residual roots would be retained, right? It's not like we were elevating those teeth. They were being knocked out. Usually one tooth per death. So it was not unusual to see a mature man without missing several or all of their anterior teeth, because each tooth signified the loss of a loved one. And there's the link for you, tooth ablation in old Hawaii. And here's a graphic of the practice, so rock and stick, so to speak. Tooth avulsion also carries over to Africa, Kenya, Tanzania, South Sudan. Dental avulsion is considered a Nilotic custom. So that's Nilotic would be indigenous to the Nile region, Nile Valley. And I became aware of this practice when I was working with a Sudan or Sudanese nonprofit, and they were trying to get oral health services for their refugees. Why? Because in South Sudan, where many of them were from, the 12-year-old boys were subject to tooth avulsion. And tooth avulsion of either the lower incisors, in this case, the group I was affiliated with, it was the canines. And so these 12-year-old boys would have their canine teeth removed shortly after they erupted, and it would leave spacing, right? And they did this for rite of passage. Again, it was not done under local anesthetic, so it was to show how tough you were, man, also for beauty in some of these cultures. And then it also affected the way they pronounced their words. So for this particular group, they were very concerned because many of them that fled Sudan and ended up in the US that were trying to get employment later, or they were going to college and they were trying to assimilate within the US culture, they were having trouble pronouncing certain words because of these teeth that were avulsed. Now, when the 12-year-old, let's say, adolescent or pubescent boy did not want to be part of this practice in their home country, I was told they were called goats or goat teeth because they still had their canine teeth. So they were subject to bullying and so forth. So they had an initiative to make sure that practice was not being done here in the US, and they were seeking some sort of oral health services for replacement for these young boys that were becoming young men, and some of the men that had also found themselves in the US. Again, if you have any questions or comments, please type them into the chat area. So tooth ablation versus tooth avulsion. I would say tooth ablation is the general term. Tooth avulsion is how that tooth is removed, all right? So tooth ablation could be just knocking out part of the tooth, or tooth avulsion is attempting to remove the entire tooth. So I would say tooth ablation is the overall term. Okay, so another practice here is Japanese tooth blackening. And this is a very unique tooth tradition, and it is not painless either. It comes from Asia, where members of tribes in Japan, Vietnam, also Thailand, the Philippines, China. This is the ritual of blackening the teeth with a dye, as we'll see. It's called ohoguru, and it's a dye that is mixed. We're going to take a look. The teeth are subjected to acidification, right? So they're using some sort of acid, just like we do for tooth bonding, so that the teeth, the enamel, become really chalky and they'll absorb that dye. Is Japanese tooth blackening reversible? No, unless you want veneers. So you'll see it's pretty intense. So ahoguru is a custom that, again, is across many Asian cultures. And they use a solution in Japan called kanamizu. It's an iron powder, vinegar, tea, rice wine. So there's the acidity, right? The rice wine, the iron powder, the vinegar, and even the tannins in the tea. And it's to celebrate an individual who's reached puberty. In the Japanese Edo period, ahoguru was performed among wealthy women who were married, but not exclusively. They were geisha. Now, early theories is that the practice was stopped. Why? Because they claimed that ahoguru was done to prevent the wife from cheating. So it was a patriarchal culture placed upon women to, in their eyes, prevent the woman from cheating on her husband, and black teeth were used to make them unattractive. So you went from beautification, it's going to make you beautiful, to it's going to make you too ugly and you wouldn't cheat on your husband. And you can see this in the two skulls here. So to your point, it is not reversible unless, of course, you wanted veneers. And they'd have to be veneers that could block out a lot of the stain, right? Okay, and also, you know, we're not talking just about the oral cavity, but we're also talking about the face. And having a white painted face was considered beautiful, especially in contrast to these thick black teeth. They believed it made the person complete and perfect. Japanese people believed this practice also hide imperfections, that teeth were yellow. So yellow teeth aren't attractive. We go the other way in this country. We do what? We bleach the teeth. In this case, they're applying a dye to cover those imperfections. So the teeth are etched, right? They're essentially etched with vinegar, with rice vinegar, and that makes them absorbent, so to absorb all of this dye here. So again, it also aims to hide all the defects of the teeth, and the material used provides protection. And they believed it led to protecting one from dental decay and strengthening the gums. And again, that is their cultural belief. Does it do that? I haven't found any evidence of that. All right, in the Vietnamese culture, it's still also practiced, stemmed from the cultural belief that long white teeth belonged to ghosts, animals, and savages. So the teeth were blackened. Young girls were subjected to 3 days of pain with charcoal, salt, and a lime solution. So the lime is the acid, and it's applied to erode the enamel for improved staining. Now, betel nut chemical dyes are then used to stain the teeth. So many of you may have treated Vietnamese patients that had used betel nut for staining. Some can still use betel nut. And if you look up betel nut, you'll see that there are some health issues with betel nut. Eventually, this signified a rite of passage for females that were ready for marriage. So again, this was a cultural practice over thousands of years, but it changed its purpose. It changed its scope. Okay, I'm going to be playing a quick video here in a minute, but this is the Mayan culture, which is an amazing culture. And it existed from 1800 BC to 250 AD. And the Mayan culture used gems and stones, valuable gems and stones, and they used them to decorate their teeth. Now, what's interesting is that the sophistication involved in placing these gems is amazing, because it was done by basically a physician. This was Mayan dentistry, and they used a hand bow or a bow drill. All right, let me go back one here. So these bow drills, they were able to cut these very sophisticated preps that lasted several thousand years. And you can see the prep here. All right, also you can see the filing, right, and the notching here. Okay, so here is a painting of the physician using the bow drill and cutting the prep to place the jewels. I'm going to show you a quick video here, and this is from the British Dental Association. And they're going to talk very quickly about the Mayan practice. And if you can't hear it again, the link is in your handout.
This is one of the oldest items in the BDA Museum. We think it dates from about the 9th century AD, and it's a Mayan tooth. And what's interesting is that it must have been drilled with a very primitive drill, a bow drill, most certainly when the person was alive and it was still in the person's head. And then this semi-precious stone was cemented in. And you can see the tooth has obviously been in the mouth for a long time, because it's got quite heavy deposits of calculus around it as well. And so this is one of our most interesting items in the museum.
I think that looks like it's jade too. And you know, what's amazing to me is the depth of that prep to be able to retain these jewels. Did the tooth not become endo involved, right? I mean, if you cut a prep like that on an anterior tooth, at some point, I think you could possibly tip the pulp of that anterior tooth, depending on their age too. But okay. All right, so we're going to talk now about the first grills, and we're going to show a brief video here. So these were Etruscan dentists. Etruscan dentists were probably also one of the most sophisticated dentists. In fact, they said that in the research that I looked, that many would travel to the Etruscan dentists and also the Mayan dentists. The Spanish invaders would go to the Mayan culture to have their dental work done. So we're going to see Etruscan gold band dental appliances, and these were considered ancient prosthetics or prostheses made to be worn over existing teeth, initially, and teeth that were intentionally avulsed, all right, intentionally removed. Then later, a natural tooth was used as a replacement. So it's almost like a Maryland bridge. The earliest is dated to the 7th century BC. And these Etruscan appliances were all worn by women, many following, again, dental ablation. And they were made by skilled goldsmiths, but the dentistry was practiced by physicians. By 630, the Etruscan metallurgists in central Italy had begun to apply their gold working skills in the production of these dental bridges and pontics. And this began with fabricating a hollow pontic, a hollow gold tooth that was mounted on a thin band of gold. All right, and there is a representative photo there of what that looked like. So again, it's almost like a Maryland bridge, and this was a hollow pontic of gold, and it was super refined gold, by the way. So let me show you a quick video here, and this is from Nat Geo, and it is going to talk about the history way back when, thousands of years ago, all the way up to now.
Deep in an underwater cave on Mexico's Yucatan Peninsula, a team of archaeologists make a groundbreaking discovery. The skulls of ancient Maya who ruled over a 4,000-year-old civilization. And perhaps most surprising was that these skulls had grills. The ancient history of grills is a little-known story, of which modern-day fans are mostly unaware.
When you're wearing grills in your mouth, you get a sense of power and dignity.
What people don't know is that grills have an unexpected history, one that goes back literally thousands of years.
These grills, they want to demonstrate status. It's like saying, I'm successful in life, that I can use gold in my teeth. Now I have money, so look at my teeth.
Doesn't sound so different than what grills stand for today. So why do they get such mixed reactions? When grills first emerged in the US in the early 80s, it was through immigrants from the African diaspora who were going through tough economic times. Ironically, gold is one of the cheapest ways to fill a cavity. So many black neighborhoods in Brooklyn and the Bronx suddenly had all these people with gold teeth. Native New Yorkers started to get gold teeth as a fashion statement. And the rise of hip-hop in the 80s led to a reclaiming of what they could represent, turning a sign of poverty into proof of empowerment. Grills finally went mainstream around 1996, when Vietnamese immigrant Johnny Dang began making his own blinged-out version of them.
My name is Johnny Dang. They call me the King of Bling, aka the Grill Master.
I would say that a lot of people out there, they have a misconception of grills.
It's been a big part of our culture. Okay, so I remember being very small and seeing my grandma Flo with a gold cap right here and my Aunt Simona with a gold cap right here.
I'm educated. I have no felony criminal history. Just because somebody chooses to show them by putting it in their mouth makes them no different from the person that has 8 cars.
This wasn't cheap, so you got to be a hard worker to get something like this, you know what I'm saying? Yeah.
Not cleaning your grill can cause bad breath.
So make sure you still brush your teeth 2 to 3 times a day.
Keep it polished, keep it shining, and keep smiling.
Okay, and again, if you could not hear that, the link is there for you in the handout. Dentures. So dentures during the late 1700s here in the US and other countries could be quite ornate, right? These are beautiful. And Paul Revere, as we know, was a silversmith, metallurgist, and made these dentures from gold and ivory. And he posted an ad in their local newspaper in Boston in 1768 that he could fix teeth as well as any surgeon dentist who ever came from London. All right, so many of you have heard the term bling, and bling is a slang term for fancy, expensive jewelry, accessories. And the word came from the idea that light glinting off of gold or diamonds would make a bling-like sound if you could hear it. So both bling and bling bling are US rap slang, and they gained mainstream popularity in the mid-1980s. So what about tooth bling? The 90s trends are coming back full circle, including music, hip hop, tooth bling, etc., tooth adornments, gems, grills, again being popularized in pop culture. And I'm sure you're seeing patients, some of you, with these jewels that are coming into your office. This is Beyonce, and look at the tooth sharpening, right? So again, we just went through some cultural practices here. These are actually removable. Okay, so tooth gems, I just wanted to bring these up in case you do have patients walking in. Occasionally, I will have a dental hygienist on here who's actually applying these in practice. And if you're here, if you do want to say something, let me know. This is Katy Perry with the gold Nike logo. This was taken from an Instagram ad called Tooth Candy. And these are 3-hour classes to teach hair salons, nail salons, piercing studios, body art salons, how to apply these tooth gems. Here's one that is a training taught by a dental hygienist. Platinum tooth gems, whitening, and so forth. All right, so I'm going to show you this quick video here. And this is how to apply. This is, again, on YouTube. So just as a demonstration.
Hey you guys, welcome back to my channel. Today's video is going to be how to apply tooth gems or tooth jewelry. So right now I'm just applying some gel called etchant, and this just opens the pores of the tooth. So I think tooth gems are pretty cool. I want some myself, but right now I have Invisalign in, so once I get my Invisalign off, I will be getting some tooth gems. Right now, I'm just letting the etchant sit on the tooth. Now I'm wiping it off with a cotton roll. And then I'm going to spray some air just to make sure it's dry, because the material that we use, if it's wet, if the area is wet, nothing will stick. So you want to make sure that it's really dry. Next, I'm going in with the bonding, and this helps bond the jewel onto the tooth. And then I'm going to hit it with my light. And then next, I'm going to place the composite material. This material is the same material that they use to put on brackets when you have braces, and this helps the jewel stay onto the tooth. It's kind of like a glue, but not really. So that's me applying a little dot. So she wanted hers in the center of her lateral. So that's the jewel. And before you cure this, you want to make sure the patient looks and make sure that it's in the right area that they want it to be in. So she wanted hers a little bit more centered and down a little bit. So that's what I'm doing here. And then I'm going to show her again to make sure that it's where she wants it to be. And then after that, I'm going to hit it with my light again. And that's it. So it's on there. It looks really good. I love these tooth jewelries. I love the tooth gems. I think it's super cute, super trendy. And I definitely want some on my teeth as well. I hope you guys enjoyed this video. Be sure.
Okay, so the question I'm always asked, and Sheila's beat me to the punch here, is it legal to apply tooth gems? In most states, you have to be a licensed dental professional to do that, the majority of states. Right, so I know in California, there are some hygienists that are applying these. They have a practice where they apply tooth gems and jewelry and other states. But again, you have to be licensed and you have to check your scope of practice. What's the 8 code for this procedure and fees? I don't know. I think we'd have to make one up. But I do want to impress upon you as we watch this. This is a multi-million-dollar industry here, folks. Right? And to me, it may not be a practice that I'd want on my teeth, but patients are having this done, right? So I think it opens the door at least to a conversation about their oral health. If they come in, I use it as a window of opportunity to have that discussion. Obviously, they've taken an interest. Now, it may be, they may have taken a left turn instead of a right, okay? But it opens the door to the conversation. Is it reversible? Is there damage? Well, depends on who's applying it. If you are just bonding, acid wash bonding, the question is, when you take it off, what's left underneath it? Has it leaked, right? Can you be getting some sort of decay or decalcification underneath it? So it potentially could be damaging. Had a patient come in to have some removed because the person who put them on could not legally remove them. And we have that as well. There isn't any, there's no coverage for this. I'm pretty sure tooth gems is considered elective without any dental insurance compensation. Yeah, I think there was possibly on my end a level of sarcasm here. But again, let me put it to you this way. When I was a dental assistant way back when, as a teen, 1982, before we wore PPE, it was frowned upon. Cosmetic dentistry was frowned upon. Like, you would never take out an amalgam class 5 because the patient preferred a composite. That was considered really sort of bordering unethical. You would certainly not remove amalgams that were considered functional and no decay because the patient wanted an all-white smile, right? So the tides have changed here. Again, we may agree with the practice, we may not, but the patients are walking in the door with this. Okay, she has another video there, how to apply tooth gems to a retainer. You can take a look at that if you'd like. Here we have gold, and gold has made a comeback, right? For a while, our patients wanted the gold removed. Now we have folks that are having gold placed. So grills, what's the history here? Called grills with a G or with a Z or fronts. They're decorative covers, often made of gold, silver, jewel-encrusted precious metals that snap over one or more of their teeth, and they can be removable, but some fabricate these gold crowns to resemble a grill. And some of the grills may be attached with glue, not meant for internal use. So I'm going to show you a quick video here. This is Madonna. She is on Jimmy Fallon. You take a look at her grill.
Two things before we get into like the meat and potatoes of our
No, I feel like you're
historical. No, I'm not going to cause any problems. Not this time. I've sold over 400 million, so you correct yourself. All right.
I'm sorry. I'm sorry.
Okay. And then the other thing is, I just got these new grills, and if I start lisping, will you tell me? I'll take the bottoms out.
Let me see them. Ooh, they're beautiful.
Do you like them?
Yeah, I do love them.
I designed them.
Wow, you designed them?
Uh-huh.
Now,
you like?
Let me see.
You guys like?
Yeah, if you start.
They're my birthday grills. It's almost my birthday, so I got myself a pair of grills.
What do you get? What do you get for the girl who has everything?
Grills.
Yeah, grills. Yeah. I thank you for doing classroom instruments. I want to get into. There's so many things I want to get into.
Okay, so the grills industry we're going to talk about here shortly, and it's multi-million-dollar industry here. Grills have a 4,500-year history. Slick Rick, who is a rap legend, credited for introducing grills in the late 80s. Nelly Rapstar credited for the resurgence when he released grills in late 2005. The first grills, again, we said all the way back 2500 BC. And evidence also suggests that the Filipino culture displayed gold grills as early as 1500 AD. During the late 90s, gold teeth were a huge trend in Tajikistan until the cost of gold went up, and Western influence led to severe decline in popularity. Gold grills are still popular in Uzbekistan, where, quote, there's an abundance of smiling faces with gold-capped teeth. Jessica said, after having braces twice, I cannot imagine electively adding anything to my mouth. I can agree with you. So here's Slick Rick with his grill. And the grill looks to me like unhygienic here. I'm not sure what's up. It looks, whoever cast it, I'm not sure they knew what they were doing. But I want to show you this Johnny Dang video here. This is Johnny Dang. He is the grill master. You saw it briefly here. He does the grills for all of the actors, sports, basketball, etc. And his grills go all the way up to the millions of dollars. And he is an artist. So let's take a look at his video really quickly here. Keep an open mind. I appreciate that because, again, you can use this as a discussion about oral health and find out maybe there's an underlying reason why somebody has a grill. Maybe they are trying to cover defects. And I have a colleague who actually presents on our platform here, Dr. Grace Sun, whose practice is in Beverly Hills. And she treats many of the stars. And she had a rap singer that came in who had a grill and had the grill placed. Why? Because he didn't like his teeth. They had defects in the enamel. And when they removed the grill, she was able to convert him over to veneers. He was just as happy. So let's go ahead and watch the video here briefly.
There's a lot of imitators, a lot of duplicators, a lot of perpetrators, a lot of pretenders. But this is the one, not the two.
You're the only one to see first, okay? He doesn't see yet.
Come see Johnny Dang when you want that official, like a referee with a whistle. Dang, Johnny!
Yes, sir! Diamond boy. The real diamond boy.
Wow. Welcome to the club where you gotta spend over a dub. You heard it.
You know, I'm king of the grill.
Of course.
Master.
We got the best grill master right here in Houston. You know, people come from all over the country, all over the world, really, come get a grill from Johnny.
Bing, let's go. Johnny, God dang. Yes, sir. Johnny Dang, sir. Actual Woods will be this weekend, this Saturday. We got an Actual Wood diamond here, baby. Johnny Dang Company, king of bling. I'm doing manufacturing.
Ain't no middleman.
No middleman, exactly. How long you work for me, man? 19 years. 19 years, man.
That's the best part about coming to this jewelry store. You get a drink in this motherfucker.
Yeah. We don't buy diamond by carat. We buy diamond by kilo, baby. Yesterday was a nice, busy day. We have all the rappers. Post Malone, one of my very good friends. We have fun. We have a good time backstage. I don't know why it's called, but not real ping pong table. What they call it, beer pong. We play beer, we play ping pong ball and drinking beer. So he good at it though. I lost.
Obrigado pela música, obrigado pela batida. A guitarra suave está tocando. Obrigado, meu amor. Obrigado.
You got everything on the list. Today I have a couple of diamond vendors. One of them came from here local, but one of them came from all the way from Israel. Most of diamond I buy from overseas, like Indian, Israel's, because of the quantity, you know? I buy a lot.
So you got $500,000 on your neck right now.
A little bit more. Just a little bit more than $500,000. I couldn't believe it. I started from small workshop in a garage, 300 square feet. Up to now I have a 16,000 square feet building, one of the biggest jewelry store with like 60 employees. I couldn't imagine. Sometimes I just look back and say, wow.
You need quarters, thirds, halves?
I like this quality but a little bit smaller size.
This is
Okay, so it gives you a good idea here. Again, millions and millions of dollars. And what's crazy is, you know, none of it's functional, right? So when you think about our patients and how many of us have taken classes on treatment planning and give our patients options and financial planning, we're trying to have them accept treatment and understand that it's important. And then you have the flip side here where somebody is wanting jewelry or grills and they're willing to pay the price for that. So if there was a way where we could tap into both of that, I think we would be golden here, so to speak. All right, so the Johnny Dang video is there for you. And he started in a small garage. He was, as he said, an immigrant from Vietnam. All right, so transitioning from antiquity today as we close down here. When examining the origin of gold teeth, its 4,500-year history, symbol of power, status, and wealth, remain constant through the ages. Gold teeth have crossed over to hip-hop artists, athletes, and beyond. There's a link there for you to Nelly. I'm not going to play it, but that is the rap song Grills. Raven said, Johnny Dang store is based off in my hometown, Houston, Texas. Good to know. Google Trends data over time. If you look at Google Trends, excuse me, in 2006, grills was like the #1 search term for some time. This was the most expensive grill. Katy Perry. Dr. William Bill Dorfman brings the bling to Hollywood. Of course, Guinness World Records now officially confirmed that Bill Dorfman has created the world's most valuable grill. And there it was, $1 million. This is a link, the How to Grills business. If you get a chance, watch this. This guy, he is on YouTube. He's a YouTuber. It's amazing Because again, we go through all these years of training. We hire consultants. We try to sit down with our patients. We learn about communication. How do we get them to accept treatment plans? Take a look at this guy. This is truly amazing. And he has laid out how one can start a grills business. Okay, dental problems associated with tooth jewelry and grills. And of course, we've had a couple of you that have asked about it. Some of these metals may be non-precious metals, base metals, right? So that can create gingival irritation for some patients, allergic reactions. We see damage to the tooth surface, especially if someone who is not taking care of their oral health or they're leaving the grills in. You heard the Nat Geo video, the guy that said you need to take them out, you need to brush your teeth, so forth and so on. Etching can destroy the enamel. There can be improper placement, staining, discoloration. So it's important, if you do, of course, have patients that present with these, that they understand that more oral hygiene is going to be required. Poorly fitting grills, jewelry can make this problematic because it can potentially create a risk of caries infection. However, you're going to see this in the quiz. This is according to the American Dental Association. There are currently no studies that indicate grills are dangerous. So there are no studies that prove they are safe either. Quick video here. This is a video of a rap star. I don't remember which one it is. Somebody may know. And he's having his grills removed. It's a bloodletting situation here. So he videoed this. This was on Instagram Live or something. It's on YouTube right now.
We don't need all this to talk about LBL. I mean, who leaks a little when they laugh?
Straight face and all.
That'd be in between your gums.
How that process we going?
I mean, that's real simple. We just inject something inside there. Put it on the side.
So we have someone that recognized Kodak Black. Okay, yeah, that's who it is. So again, the situation, you have these folks, maybe they're covering up something that's not desirable in their smile, and it's a way to open the conversation. So as Dr. Sun said, she's treating many of them, she finds out they don't like their smile, they don't like how their teeth are positioned, so they're covering it up. And then they may just want it. This is a patient education sheet here from the American Dental Association that you can actually download and offer up to your patients. And these are citations for you. And are there any questions for me? Is it fair to say that grills tooth gems are a risk factor for decay and inflammation? I think anytime that you add something that is not natural in the oral cavity, even, orthodontia is a risk, right? So I would say yes. That's why I say that if you do have a patient that has something like that, that they need to understand it's going to require more oral hygiene. And if you have somebody where oral hygiene doesn't really enter into the picture, I think the answer would be yes. Thank you, Monica. I appreciate that. I need to check out Kanye's new $750,000 titanium dentures. I will check that out. So again, I hope you found this information valuable. If anything, when you're seeing a patient where it is a different cultural practice than what you are accustomed to, it's a great way to learn. right? So ask them about the practice. Find out how it occurred or why it occurred. And maybe you'll learn something. And again, you'll open the door to better oral health for that patient. All right, so thank you so much for being here. We're going to go ahead now and transfer you to a different screen. So I'm not sending the link right now. Why not? If you're a knowledgeable, experienced, licensed professional who can apply a tooth gem correctly and educate the patient about proper hygiene, go for it. Yeah. Thank you, Raven. I appreciate it. Having trouble getting the link to the ADA sheet to work. You might have to try a different device or just do a search on the ADA for grills and it will come up. All right, everyone. So let me go ahead and sign you out. You're going to now be redirected to the quiz. Go ahead and complete it. You'll have your certificate. You should have it within a minute. All right. So thank you all for being here. So tomorrow is a new class that I am teaching on periodontal inflammation and disease drivers. And it will be offered live every month. So if you can't attend, it'll also be offered on demand. Saturday is infection control, 3 hours. So if you need infection control, check it out. And I'm really happy that you all joined the course this evening. Please reach out if you have any questions. Here comes the quiz.